is a broad classification of surgical emergencies in pediatric surgery. Okay, so I think classification of these surgical emergencies in pediatrics is a basis of classifying it. I think it's based on the age range. Okay, the ones that could occur in neonates, the ones that could occur in adolescents, the ones that could occur in what do they call it? Teenagers. Okay, so for classifying abnormalities, okay, that classification is based on age. Okay, so the proper classification is based on like what is the origin of the abnormality. Do you understand? So you can have congenital anomalies. Congenital, that means the person was actually born with that abnormality. Okay, so you can have things like the tracheoesophageal fistula. You can have things like duodenal atresia. You can have things like intestinal malrotation volvulus, then congenital diaphragmatic hernia, then pyloric stenosis. Alright, so you are having a blockage, okay, in the pylorus, okay, muscle thickening around the junction. Then abdominal emergencies, you can have things like intussusception, which I have the picture here. Okay, the intestine is kind of like falling back into the other one, you know. Then you can have things like appendicitis, Meckel's diverticulum, Hirschsprung's disease, also known as enterocolitis, then biliary atresia complications, like probably the bowel system is kind of like becoming, you know, smaller. Okay, so you're having all those complications. Then thoracic emergencies, that's emergencies that have to do with the chest region. So things like impairment, complicated pneumonia, then mediastinal masses, that's tumor masses, then foreign body inhalation. Okay, the child could actually inhale a foreign body and all of that. They could also have the genitourinary emergencies, things like testicular torsion, then paraphimosis, then obstructive uropathy. Okay, that one could actually make them retain, you know, urine back in their body. So you can have trauma-related emergencies like head injuries, abdominal injuries, okay, thoracic injuries, abdomen, right? Different organs are in the abdomen, so they could actually get injured, you know. They could also have thoracic traumas, okay, then orthopedic traumas, okay. That's where you have all those fractures, compartment syndrome, and the rest of them. So this forms the classification of what emergencies we have in pediatrics. So that's